Welcome to this explainer. If you or someone you love has recently gotten a cancer diagnosis, I know exactly what happens first. The room just completely spins, your anxiety spikes through the roof, and suddenly you're lost in this terrifying sea of medical jargon. And hey, it is absolutely completely okay to be afraid. But today, we're going to replace that paralyzing fear with something so much more powerful, and that is informed hope. We're going to dive into today's real medical data to show you exactly why surviving cancer in 2026 looks fundamentally different than it ever has before in human history.
Okay, so here's our roadmap for today. We're going to cover 5 clear steps. A new era of hope. Understanding the 4 stages. The standard treatment playbook, next-generation therapies, and finally, taking control of your journey. Let's get right into it.
Section 1. A new era of hope. Let's talk about survival statistics.
These numbers perfectly illustrate the massive leap we've made. Back in the 1970s, a cancer diagnosis was kind of like a coin toss. Only about 5 out of 10 people survived for 5 years. But today, that overall survival rate has surged to 70%. We're talking 7 out of 10 people living at least 5 years, and honestly, often much longer. Cancer is literally no longer the automatic death sentence it once was.
And when we break it down by specific types, the numbers become incredibly reassuring. Take prostate cancer. The 5-year survival rate is a staggering 98%. Thyroid cancer, also sitting right up there at over 98%. And breast cancer boasts a phenomenal 92% survival rate. Now, obviously, some cancers are still really tough, but across the board, the progress is absolutely undeniable.
The absolutely crucial takeaway here is this total paradigm shift. Cancer is really ceasing to be a disease that just kills quickly. Instead, for so many people, we're increasingly treating it as a manageable chronic condition. It's actually a lot like how doctors treat diabetes or high blood pressure. There are folks right now living 10, 15 years with cancer. They're actively controlling it, going to work, caring for their families, and really just enjoying their lives.
Moving on to Section 2, understanding the 4 stages.
Now here is a powerful analogy that perfectly explains a concept that honestly usually sounds pretty intimidating. The stage of a cancer is really just a measure of how far it's spread in your body. So think of it exactly like a house fire. If you catch a fire while it's contained to just one tiny room, you can put it out relatively easily, right? But if that fire spreads out into the hallways and into other rooms, it obviously becomes a lot more complicated to fight. Not impossible, but complicated. Doctors just need to know exactly where the fire is so they can pick the right tools to fight it.
And here's how that builds across the 4 specific stages. In stage I, the cancer is in a small, isolated place. That's your single room. In stage 2, it's grown a little bit, but it's still totally localized. By stage 3, it's spread to nearby tissues or lymph nodes. And stage 4 means metastases. That's when it is spread to entirely different parts of the body.
Let's look at colon cancer outcomes for a second, because this stark comparison perfectly highlights why early detection is literally the single biggest advantage you can possibly have. If colon cancer is found early in stage 1 or 2, while it's still localized right there in the intestine, a massive 90% of people survive. But if it isn't discovered until stage 4, when it's already spread, well, that survival rate drops pretty sharply to 15%. This is exactly why finding that fire early changes absolutely everything.
All right, Section 3, the standard treatment playbook. Let's look at the first-line plan.
So once your medical team knows the stage, how do they actually fight the fire? Well, they put together what's called a first-line plan, and they use highly refined versions of tried-and-true medical tools. Surgery is still one of the best options for localized cancer. But today's techniques, they use tiny cameras and minimally invasive procedures that drastically speed up your recovery. Chemotherapy still uses medicines to kill fast-growing cells, but modern medicine has developed incredible drugs to successfully minimize those awful side effects. And radiation therapy? It now uses ultra-precise, high-energy rays that specifically target just the tumor, actively sparing the healthy tissue around it.
Which brings us to Section 4, next-generation therapies. This is the true treatment revolution.
This revolution really kicks off with targeted therapies. Instead of affecting your entire body the way traditional chemo does, these medicines act like heat-seeking missiles. They specifically identify and attack the unique genetic mutations within the cancer cells themselves. Because of this astonishing breakthrough, a patient with a specific mutation might be able to control their tumor for years by literally just taking a daily pill. It's wild.
Then we have immunotherapy, and wow, this is undeniably one of the most awe-inspiring areas of science right now. Instead of using outside chemicals to attack the cancer directly, immunotherapy actually trains your own body's immune system to independently identify and destroy those cancer cells. This internal training approach has completely transformed the landscape for melanoma, kidney cancer, and certain lung cancers. It is giving years of quality life back to patients who previously might have only had months.
But the arsenal doesn't stop there. Not even close. Doctors also use hormone therapies to essentially starve cancers that depend on hormones, like a lot of breast and prostate cancers. There are cutting-edge cell therapies where your immune cells are physically modified in a lab to attack specific leukemias and lymphomas. And hey, if that first-line treatment doesn't work out, your oncology team always has a plan B and a plan C. That includes clinical trials, which give patients access to tomorrow's cutting-edge therapies today, years before they're available to the general public.
Finally, Section 5, taking control of your journey.
I really want to take a second to speak directly to your very valid fears here. If you're feeling lost in a sea of medical terms, dealing with sleepless nights, just breathe. Seriously, let yourself feel that fear. But please recognize that you are absolutely not walking this path alone. Those statistics we went through earlier, they aren't just cold numbers on a chart. They represent real living people, their parents, children, and friends who are actively working, laughing, and loving right now because science advanced and they didn't give up.
Think of these next steps as your personal empowerment guide. First up, find a medical team you implicitly trust. Second, ask every single question that pops into your head. I mean it, there's absolutely no such thing as a dumb question when it comes to your health. Third, seek out support groups, lean on friends, find a counselor. You do not have to do this in isolation. Fourth, take care of your physical body. Eat well, move when you can, and get plenty of rest. And fifth, prioritize your emotional health because your mind needs just as much care as your physical body right now.
Let's end on this critical thought. We are entering an era where, little by little, cancer is becoming a condition we can actively control and live alongside. The science is progressing every single year, and the tools are just more precise than ever. So how will you use this informed hope to confidently navigate your next steps? Lean on the incredible medical advancements we've explored in this explainer, talk openly with your doctor about your specific case, and boldly face the road ahead. We're wishing you strength, clarity, and healing.